Can you share why you think it is important for your community members to take the vaccine? Why is that important? So we'll start with Aaliyah. Let's start with you first.
Yeah, so the vaccine is really important in our efforts to get back to life. The vaccine, it helps prevent you from getting seriously ill. It can help protect those around you from getting seriously ill. So your mom, your dad, your family, your friends, your team members, co-workers, really just overall really crucial in helping to protect the community. Especially those who might have increased risk of having severe complications from COVID-19 overall and in general. It really is one of the best tools we have now to stop the pandemic, to end the pandemic, and to get back to life. I always say I don't know about you all, but I miss popping in on my mom and my grandparents here and there. But now really just recognizing that it is on me to make sure that they are safe. They both and all suffer from some of those underlying health conditions, and I would hate to ever do anything that might critically harm them. And so this vaccine is really, really an important tool and just getting back to life, and really reuniting with our close family members and community. And it's just always just really emphasizing that it's safe, like it is safe to use, and it is an important tool, especially right now.
Thank you. And Peter, you're next. I know you mentioned why the vaccine was critical earlier. Can you touch on that a little bit more, please?
Well, yeah, and even further for the Latino community, we tend to have multi-generations living in a household. It's very, very common for us to have our parents, and the grandparents have grandchildren, so multi-generations. And so how are you going to keep a household safe? You're going to keep it safe. You're going to keep that house safe by wearing masks and by getting vaccinated as soon as you possibly can. That's the way we have to do it, and we have to keep pushing that so that we can get life back to normal. And there's so much going on that we don't even know about yet. The mental health issues, the depression, alcoholism, all the things that a lot of those things affect our communities of color already. So this just exaggerates it. I mean, it just takes it to a whole nother level that, we're going to feel the pain of this even when we way after COVID. I mean, there's going to be issues and it's going to take community leaders to stay involved and stay engaged to save our country.
Thank you, Peter. Roxann?
I echo the sentiments of Aaliyah and Peter as well. I think it's important for us to take the vaccine just so that we can save lives. We've seen lives taken at an alarming rate in this past year and a half, and it hits very, very close to home. We're watching family members dying alone in hospitals, and people afraid to go and get help. And those that are being affected with COVID are just really suffering and having long lasting effects after they've gotten over COVID. And so if we want to see any sense of normalcy, at least a little bit as we knew it pre-COVID, the vaccine is going to be the way to do it. We cannot continue to go on as we have been. Before the vaccine was rolled out, we saw those numbers really rising high, people contracting the virus, people expiring because of the virus. And I personally would like to see that trajectory change in a downward motion, and we start seeing less people hospitalized so that our frontline workers can get back to their families and their lives. And so we as communities can get back to living our lives and open our economy back up and keep our families and our loved ones safe.
Thank you. Dr. Lee?
Well, from a cultural context, we're all interconnected in multiple ways, whether it's through the ecosystem, through our relational clanship systems, intertribally, and within our tribes. And so it's about really ensuring that our relatives are taking care of themselves, and it's not, it's helping our whole community as a whole, as we all do this together, because we're all, you know, we have a lot of relations in our community, and in Navajo it's called K'e, which is the single most important thing in our community is our relationship to ourselves, our relationship to our family, our relationship to our community, our relationship to the ecosystems, the plants, the animals, and even the universe. So we have this huge responsibility of ensuring that our relationships are kept safe. And in addition to that, again, that I have known over 60 people personally who have passed from COVID. And my grandfather's, one of them just passed away on Wednesday last week. Now, when I also talk about how much we're losing through our elders, our language and our culture is being lost for every elder that we lose, which is very significant in our communities. And in addition to that, we have a lot of ceremonies that require some sort of gathering. And because of COVID, we're unable to upkeep within our ceremonial systems that help to retain and learn the language and the culture as well. And my organization runs an entire quarantine site in Phoenix, Arizona. So since COVID in March of 2020, we have serviced over 1,000 Native Americans in the state of Arizona and neighboring states. To number one, we do quarantine services, but in addition to that, we address mental behavioral health, and in our communities and communities of color, substance use increase, domestic violence increase, housing security increase, mental health decrease. So we're seeing a lot of the lashback that COVID has did to our community. And right now I'm actually at our site, and it's to get that firsthand of the experiences of helping families to know that the resources out there are so needed. And just getting the vaccination is extremely important for so many reasons. So thank you.